Good morning, Dr. PK from Dr. PK Live. This is in response to my video about LDL is not the full story, why ApoB may predict heart attack. So Dr. Nisar Afridi answered this question. Every atherogenic lipoprotein particle contains exactly one ApoB protein, unlike LDL cholesterol, which measures the amount of cholesterol. ApoB measures the actual number of harmful particles, making it more accurate predictor of cardiovascular risk. I believe ApoB testing will increasingly become part of routine practice and may eventually replace LDL-C as primary marker for assessing heart disease. Absolutely agree, Dr. Nisar. ApoB reflects number of atherogenic particle, which is why it often correlates more closely with the cardiovascular risk than LDL-C. And I think this may be one of the most important comments I've received about cholesterol. And the fact is that LDL isn't the whole story. So let's talk more about ApoB. My purpose is to educate people so that they can be proactive and save their heart. Most people know their LDL, very few know about ApoB, and that could change how we prevent heart attack. Dr. Nisar, thank you very much for excellent comment. I completely agree. One of the biggest advances in preventive cardiology is understanding that LDL cholesterol and ApoB are not measuring the same thing. Think of this way. Imagine cholesterol is the cargo inside the delivery truck, and LDL tells you how much cargo is being transported, while ApoB counts the actual number of trucks on the road. Each potentially harmful lipoprotein, whether it is LDL, VLDL, remnants, or LDL or lipoprotein A, contains exactly one ApoB protein. That means measuring ApoB tells us how many particles have the potential to enter the arterial wall and contribute to plaque formation. And why is that important? Two people can have same LDL cholesterol of 100, but one person may have very small LDL particle while the others have few large particles. The person with more particles have more opportunities for those particles to penetrate the arterial wall, increasing the risk of atherosclerosis. And even though the LDL number looks identical, that's why ApoB often predicts cardiovascular risk better than LDL cholesterol alone, especially in people with diabetes, metabolic syndrome, high triglyceride, obesity, and insulin resistance. Other important marker is lipoprotein A, LPA, which largely inherited and carries additional ApoB containing particles. So if your lipoprotein A is elevated, your cardiovascular risk can be significantly higher even when your LDL appears normal. Current international guidelines increasingly recommend ApoB as an important risk-enhancing marker, particularly when standard cholesterol do not tell the whole story. Will ApoB completely replace LDL cholesterol? Probably not in the immediate future. LDL-C is an inexpensive, widely available, backed by decades of research. But I do believe that ApoB will become a routine part of cardiovascular risk assessment, as Dr. Nisar mentioned, in future. And when testing becomes more accessible and affordable, the future of preventive cardiology is moving towards treating the patient, not just treating cholesterol number. Thank you again, Dr. Nisar, for adding such a valuable insight to this discussion.